Today our talk will be about consequences of eating disorder. Eating disorders is an unhealthy preoccupation with food, weight, or appearances that interfere with everyday life. Disordered eating behavior and eating disorder are not a choice. They develop due to a combination of an individual genetic, social environment, psychological health. Eating disorder can be treatable with support of family, friends, and community. A community and professional team of physicians, nutrition experts, and psychologists. Eating disorder have the second highest fatality rate of all mental illnesses, yet they remain widely misunderstood. Anorexia nervosa, bulimia nervosa, binge eating disorder, and their variant consist of severe disturbances in eating behavior and weight management. They often coexist with other mental illnesses such as depression, anxiety, obsessive-compulsive disorder. Consequences of eating disorder are serious and can be life-threatening. They include a range of conditions that involves obsession with food, weight, and appearances. There are types of eating disorder. There are many different terms to describe eating disorder. It is important to know the diagnosis. And the diagnosis is not everything. Most individuals with eating disorder experience behavioral spectrum. Anyone who struggles with the relation between body, mind deserves support and health. Though eating disorder present differently for individuals, the pain and suffering of eating disorder is inclusive of all. The first type is anorexia nervosa, involves severe restriction of food intake, leading to significantly low body weight, less than 85% of the ideal weight based on the age and height. A person suffering from anorexia nervosa has an intense fear of gaining weight, even when they have dangerously low body weight. This person may also have disturbed body image, meaning that they truly feel and believe that they are overweight, even when they are clearly underweight. Someone with anorexia nervosa often evaluates his or herself based on the body image and may not recognize the seriousness of their condition. People with anorexia nervosa often limit or restrict other parts of their life, but beside food, including relationship, social activity, and pleasure. There are two types of anorexia nervosa, restricting type and binge eating type. Binge eating purging type. A person with restrictive type of anorexia nervosa do not engage in binge purge behavior. Their weight loss is from severe restriction. The binge eating purging of anorexia nervosa, recurrent episodes of binge eating and or purging behavior, which is self-induced vomiting, misuse of diuretic, compulsive exercises, laxative, or enema. Bulimia nervosa involves cycle of binging and then compensating for the intake. Binging is consumption of large amount of food in a very short period of time. A person suffering from bulimia nervosa often does not feel in control during the binging episode, and most often will immediately engage in behavior to compensate for the binge. Dangerous behavior include self-induced vomiting, misuse of diuretic, compulsive exercising, laxative, enema in order to prevent weight gain. Similar to someone suffering from anorexia nervosa, some of the bulimia nervosa places a lot of emphasis on their body shape, weight, and self-evaluation. Those suffering from bulimia nervosa seems to be at higher risk for dangerous, impulsive, self-destructive behavior, such as self-harm, alcohol, drug abuse, sexual promiscuity. Bulimia nervosa is different than binge eating purge type of anorexia nervosa in a few ways. Someone struggling with bulimia nervosa does not restrict. It is not necessarily underweight often recognize there is a problem. Binge eating disorder. The essential feature of binge eating disorder are recurrent episodes of consuming abnormally large amount of food and sense of lack of control. Someone struggling with binge eating disorder may eat whether they are hungry or not and consume food well beyond being uncomfortably full. They often feel extremely distressed by their eating behavior and may experience feeling of disgust and guilt both during and after binging. Binging eating disorder is different from bulimia nervosa as it does not involve compensatory behavior. Binge eating disorder is the most common eating disorder among all diagnosed and is often disregarded due to our culture and weight stigma. Binge eating disorder is just as dangerous as any other eating disorder. Avoidant and restrictive food intake disorder. This involves extreme eating or feeding disturbances characterized by avoidant or restrictive behavior regarding food that limits the caloric intake of the individual. The limited caloric intake causes inability for the individual to meet the nutritional requirement, resulting in an inability to maintain healthy weight or gain weight required for the development, especially in children or adolescents. The 𝒅𝒑 is primarily diagnosed in childhood or adolescent, and individuals with 𝒅𝒑 are often thought of as extreme picky eater. However, individuals with this problem are not the same as picky eater or individual going through the phase of selective eating because 𝒅𝒑 is similar to anorexia nervosa in terms of the avoidant restrictive behavior. Although the 𝒅𝒑 does not involve the fear of gaining weight or distorted body image. There is not a singular cause for 𝒅𝒑, although it can occur after a traumatic experience with food choking or personal experience. Other specified feeding or eating disorder, there is a condition called orthorexia. It's an eating disorder term used to describe individuals who are obsessively restrict their diet to what they deem to be healthy food. The rigidity and the obsessiveness of this eating disorder interrupts daily and physical activity. Other specified feeding or eating disorder, many people suffer from disordered eating when those symptoms cause significant distress but do not meet the full criteria of an eating disorder mentioned above. They may be still diagnosed with eating disorder. Their health and well-being may be in danger, should seek help from professional. Eating disorder, not otherwise specified, was formally changed in the DSM-6 to other specified feeding or eating disorder. It is named diabulimia. Individuals with diabetes mellitus type 1 can struggle with an eating disorder called diabulimia. Those who struggle with this eating disorder manipulate the use of insulin needed by the body in order to lose weight or change the appearances of their body. Because this is a subject that requires a lot of talk and psychotherapy and follow-up, I limited the treatment side to just mentioning it because the whole illness revolves around family support, psychotherapy, and medication. I hope this small talk is informative to you. End of dictation.